all through this school year, through the pandemic, to bring you the latest information about return to school. And I'm so thrilled that you're out here tonight to join us for this important conversation. I am joined by wonderful guest, Dr. Michelle Boyd, our Assistant Superintendent for Special Services. And she's here tonight. One of her responsibilities is the area of health services, and she'll be talking to you here shortly. We also have Dr. Michael Martin, who is a pediatrician here in Fairfax County and is president of the Virginia chapter of the American Academy of Pediatrics. Dr. Martin brings over 19 years of clinical experience, and he's here tonight to also talk about return to school, to talk about some of the CDC guidance, but also talk about the social, emotional impacts on kids during this pandemic and the importance of returning all of our students to in-person learning as soon as we can. So it's great to have all of you here this evening. I'm going to start by talking to Dr. Boyd and then Dr. Martin, but we'll be taking your questions, answering phone calls, looking at emails, and thanks again for being with us this evening. Dr. Boyd, we are going to start with you. We've been busy adapting to the new news of the CDC that recently gave us guidance to allow us to look at moving to 3 feet. And we've been sharing with our community just earlier this week that we are beginning to use that guidance to expand opportunities for in-person learning for 4 days for our students that are struggling in school, and also for students who've already selected 2 days of in-person to go to 4 days as space allows in schools based on their staffing capacity and school capacity. Tell us a little bit more about this guidance and how schools are beginning to do this here in Fairfax County Public Schools.
Sure. Thank you, Dr. Brabrand. So we are excited that the CDC has allowed for schools to be able to implement 3 feet of physical distancing as opposed to 6 feet in classrooms between students when mask wearing is on, as that allows us to support greater numbers of students in person. And so, as you said, we're using our multi-tiered systems of support to look at a variety of data sets to support students. So our academic data, our social and emotional data, to support all of our students that are in need and prioritizing those students. We do have some physical capacity pieces that would vary by school. And so our numbers of students that will return back in person, whether it's through our MTSS process or whether it's the 2 to 4 day process, may vary by building, but we are looking at that data as it allows.
And so, Dr. Boyd, we have a slide for our community to see. So starting this week, the week of April 6th, and next week, we're really going to be focused on those struggling kids, those MTSS kids that school personnel are identifying, and schools will be reaching out to parents, if they haven't already, to invite them back this week and next week for 4 days of in-person instruction. And we'll continue to provide bus transportation for these students as needed, though we certainly understand that some parents continue to prefer to drop off their kids at the kiss and ride, and that will continue to happen. What else are we going to be able to do in the weeks ahead after we do our MTSS kids?
So after we do our MTSS students, we will be again expanding those supports for students who are already in person from 2 days to 4 days. And again, those persons, those families will be reached out and be contacted. We're looking at making those contacts the week of April 13th, and those students will be starting on April 20th. And again, transportation will be set up for those families that wish to access that resource. And as you said, the kiss and ride will continue to be an option. So we shared earlier just
Dr. Boyd, so next week, if my kid's in person right now for 2 days a week, schools will reach out as staffing and capacity allows to give my kids the opportunity to go 4 days a week. Again, that will vary school by school.
Correct.
Why does that vary school by school? Why will that vary school by school?
Great question. So right now, our numbers of students that are currently served in person vary greatly across our district. We have some schools that have approximately 20% of their student population that are in school, and we have other schools on the other end of the continuum that have about 80% of their students in person. And so the current number is one factor. We also know that physical space and the setup of classrooms and buildings varies by school, and also staffing capacity might vary by school. So we know that that dynamic is not something that's going to be universal throughout, but we have established 2 key mechanisms that will consistently be used, those 2 variables being the MTSS or multi-tiered systems of support process and the going from 2 days to 4 days process.
So 2 things from what you just shared. One, what a range. Fairfax County Public Schools is very diverse. The range of families and communities selecting in-person goes from 20% at some schools, very few students in person, to almost 80% at other schools. So that really is why it doesn't look exactly the same in each school and each community based on what parents chose.
Correct. And we know that this is something that's different for families because typically pre-pandemic, we have consistent and universal supports, but we really do want to meet the unique needs of all of our students and our families. And again, that's just going to vary based on the structures and dynamics of each individual school.
And Dr. Boyd, you talked about prioritizing those children most struggling, and we're talking about multi-tiered systems of support. For our folks out there who may not know what that is, can you talk about how does that actually work at a school? I know you're in charge of our special education students, but it really could be a general education kid or a special education kid. How does that kind of work at schools to be able for them to identify those students that really need to be coming back for 4 days of in-person instruction?
Right. So our school teams, and I say teams because it definitely takes more than one person to look at the various data sets that you would look at. So certainly they look at grades, but we also look at if students have IEPs, are they making progress towards their goals? Are students socially and emotionally disconnected? Are they having some challenges, significant challenges there that are manifested that would require them to be higher on the need level in terms of receiving some in-person supports, whether it be counseling from a school counselor, psychologist, school social worker. And so our staff look at a number of different variables. And again, as Dr. Brabrand shared, it could be a student who has an IEP, it could be a student who has limited English proficiency, but it may be a student that does not have an individualized education plan or a limited English proficiency plan. So all of the students are looked at prioritizing what are those greatest needs. And again, while many of our families may want to prefer their students to come in person, there may be some students who may not at this point be able to be supported in person because there are other students with more significant needs academically, social, emotionally, and or behaviorally.
Okay, well, thank you so much for sharing that. We know the CDC guidance is very clear. Regardless of the community transmission, elementary schools are moving to 3 feet. The CDC guidance also talked about middle and high schools and the possibility of them being able to move to 3 feet, but only if community transmission was not in the high range. And I think we have some information to share with our viewers. Hot off the presses today, that we have, and again, this date was picked weeks and weeks ago, folks, but hot off the presses today that our community transmission has come down from high into substantial, and under substantial, we are going to be able to allow our middle and high schools to move to 3 feet as well as our elementary schools.
Yes. So based on the information that is shared on the screen, we have a number of data points, but the key piece is right now, our overall community transmission in Fairfax County, which is the data that we use, our 7-day average based on 100,000 persons, our number of cases, falls within that substantial range. And as you shared, Dr. Brabrand, today, the data came out today. It's updated weekly on Wednesdays. And so that allows us to implement that 3 feet physical distancing at our middle and high schools. And so our schools were already planning, utilizing that MTSS process previously, but now our middle schools and high schools can now expand those plans utilizing the 3 feet physical distancing capacity, which may enable us to support more students through our MTSS and through our 2-day to 4-day process.
That's fantastic. You know, Dr. Boyd, some of our families are still concerned about COVID transmission in the schools, regardless of the transmission level in the community. Can you talk a little bit about what has our transmission been like since January, since we really returned? We took that break in December when numbers really rose, but since January, and when we began returning some kids at the end of January, what has our transmission rate been like these last few months?
Sure. So we are extremely excited that our transmission rate has been extremely low, less than 0.5% of COVID cases in our school, and even fewer cases where there was transmission in schools. And we really attribute that to a couple of things. We know that it was previously called mitigation strategies, and an updated information from the CDC is referred to as layered prevention strategies. But we know that the mask wearing, the social distancing, the hand hygiene, respiratory etiquette, and working in collaboration with the health department for our contact tracing has really been vital. And we have a lot of persons, our students and our staff, are working hard around these layered prevention strategies. And so we continue to educate and to really encourage one another. And so that's really helped us to keep our cases very low in school. And of course, we want to get better. We always want to make sure we want our students to be healthy and safe, and our staff and our families. So we're always looking for ways to get better, but we have extremely low transmission as it is right now in low cases.
And I see, actually, you know, you mentioned less than 0.5%. I have here 0.2% transmission in schools and our buildings between January and March 15th. That's just tremendously low. We want to keep it that way, and we want to continue to improve to get that almost to zero. But the risk of transmission in schools, with our experience here in Fairfax County Public Schools, our data, our community, extremely, extremely low, less than 0.5%. That's just terrific. Thank you for all the work I know your teams have been doing and working in our schools and working with those mitigation teams to keep schools safe. Let's take a few calls before we go to our next guest. Caller, welcome to the Return to School Town Hall.
Hi, Dr. Brabrand. Thank you so much for taking my call.
You're
I
welcome.
appreciate it. I have a question about what the plans are for this fall. If we're not able to get more than a certain number of kids into the classrooms today with the 3 feet of social distancing requirement that's going on now, like you said, at middle schools and high schools, how is this going to work for the fall term if those same 3 feet of social distancing guidelines are still in place? How are we going to get 100% of our students to have the option to come back to in-person learning 5 days a week if that can't be offered today to our students?
No, thank you for that question. That's a great question. It's one of the questions we are getting more and more about. We're going to continue to work with our health authorities as we have all along to continue to support us in doing return to school. Many school districts in this country have been able to return to 5 days of in-person instruction and do so safely. We have revised studies out of Wisconsin. We have studies out of Massachusetts that are supporting returning to schools in person. It is one of the things that we're looking at, our class size capacities right now, but we believe we are going to be able to make it work even at the 3 feet guidance. It is guidance. There may be a few cases that we're going to have to look at in certain classrooms. We also are going to need to look, and we have some additional reserve staffing where we can provide schools some additional staffing to keep that class size low enough so that we can maintain the social distancing. So hope that is helpful information to you. We're going to continue to monitor the health guidance. And you know, the guidance has changed. Even just in the last month, the guidance from the CDC has changed. And we expect that it may continue to evolve as we approach later in the spring and in the summer as vaccinations continue to increase in our community and around the country. Let's take another call. Caller, welcome to the Return to School Town Hall.
Hi, Dr. Brabrand. My question follows right along with the one before.
Yes, ma'am.
I saw you on the news last night, and you were quoted as saying FCPS can expand in-person learning even at 6 feet distancing, and that was a little surprising to me. But given that, and our new guidelines saying that we only have to have 3 feet of spacing, I'm wondering why more students aren't being offered 4 days in person right now. I'm hearing from a lot of, friends and people in the community that their school principals are not expanding to 4 days of school in person for their students. I'm wondering if we can't do 4 days now, how in the world?
Thank you, caller. I at the very end, I think you were going a little bit in and out. But the question is, if we can expand, why can't we do it for more? And listen, we are expanding in-person instruction for our most vulnerable kids. We are expanding it for our kids 2 days, who've chosen 2 days to 4 days as staffing and capacity allows. Part of our challenge is all of the logistics involved in the thousands and thousands of kids that we are bringing back in person. And we have made a decision that those families who chose virtual and whose kids are not identified as struggling through the MTSS process will remain virtual for this year. There is only so much operational capacity that we have to make all of the changes necessary, and to recognize that in this school year, we will soon, as we finish the month of April, be pivoting into our month of May, where we have all of our end of the year state SOL assessments, which continue to be a part of our school experience, all of our AP and IB tests, and it's simply trying to be able to do what we can with the capacities, staffing capacities that we have. Everybody on our staff has worked hard this year. Everybody has been committed to returning students to in-person instruction, but it truly is a balancing act of our abilities to do so. So thank you for that call. We certainly understand. Let's take one more call. Caller, welcome to the Return to School Town Hall.
Hello, Dr. Braben. What is graduation going to look like for our high school seniors this summer? Thank you.
Sure, thank you. We've been spending a lot of time, and I want you to know that I've been spending a lot of personal time advocating in the governor's office for in-person graduation, working with the state superintendent and the Secretary of Education, and I really want to say I feel that our voices have been heard. We have gotten additional guidance that we will be sharing out soon that will allow us to have in-person graduations for all of our students at all of our high schools. High school principals are working through the final logistics, and we'll be sharing with the community the specifics of where their graduation will be and when it will be, and there will be some, of course, safety mitigation practices. There will be some capacity limits based on the venue that is at. We also have been working with the governor's office around social gathering capacities, and we will have some additional flexibility there for social gatherings, things like prom or all-night grad that can go outdoors up to 100 kids. It means we're going to have to be creative. It means we're going to have to do things differently, think out of the box, and we are engaging our principals in those conversations, and they will be reaching out through their communications to the community around how we will make some of these things happen in a different way. But we are here to celebrate our students, especially to celebrate our seniors, the class of 2021. And I'm thrilled that our community and these kids will get an in-person graduation experience, and a safe one, following very carefully. And we committed to the state we would. And I'm asking the community that as we go to these graduations, you work with school officials and follow the policies that will be shared and communicated with you. So thank you, caller. It's great to have our second guest talking about all the safety and really working with the state and the state level. Thank you, Dr. Martin, for being here. And thank you for your leadership, not just as a pediatrician here in Fairfax community, but really taking on the mantle of leadership statewide to represent pediatricians across the state. And really, you all have been an advocate about returning for in-person learning. Tell me a little bit about your journey and what you've seen through your lens as a practitioner that's helped you and your association say in-person learning is so important.
Well, first I want to thank you guys for allowing me the chance to be here and part of this. It's in a conversation, like you said, we've been very much involved with. So for the Virginia chapter, we've actually had a school reopening work group, a task force actually, that has been working with a number, not just Fairfax County, but across the state, working with school systems to help them and coordinate reopening and what that looks like, which it looks different all over the state. Sure. Having said that, across the state, for us, we really have been witnessing a number of problems for families and for students and kids, all the way from toddler up through college, from not being in these social settings of school and the learning environment.
And I hear you have some data, Dr. Martin, that we can share with our viewers that you have been seeing and your association has been seeing.
Sure. So our chapter is made up of about 1,300 pediatricians, and so we surveyed them, got about a little over 200 of them to respond back in terms of what they were seeing. We felt it was really important. We were seeing national data, showing the huge increase in mental health problems across the country. But we wanted to know in Virginia, are we seeing the same thing? And it really did corroborate what we were seeing at the national level. So this was back in late winter. We found that, in anxiety, and in the next slide you're going to see depression, we were seeing upwards of 90 to 95% of pediatricians reporting either increased or greatly increased numbers of kids that were either being screened on screens during their well checks or coming in as their primary complaint.
So
these
I see
issues.
really on that graph, no decreases, but only increases or great increases in depression and anxiety. So real significant change.
Real significant changes, and I will tell you, this is actually, we're collecting data now. This is actually getting worse. It actually hasn't gone down. It's been something we're seeing, and I can tell you in practice, most of us are seeing a huge increase in number of kids we're admitting to the hospital for mental health problems. I'm probably in my practice admitting 1 to 2 kids a week. I wouldn't do that in the size practice I have. I maybe once every 6 months, I would have 1 child be admitted. We're doing that on a weekly basis now. And I will say that's across the region as I talk to pediatricians, in Fairfax County, but also in other regions as well. It's not unique to our region.
And you all put out a guidance document for safe schools that have provided guidance for not only schools reopening safely, but also returning to sports and physical activity, which we've been doing in Fairfax County as well. Yeah. So tell us a little bit about that.
So this really worked in parallel with what the CDC has done, and I always stress that these are guidance documents. So when VDH also publishes, the Virginia Department of Health will publish these guidance documents as well. Usually they mostly overlap in the advice that they give, but the National AAP came out with this guidance as far back as summertime. I think it was in August or July that the initial guidance, and continues to revise it. And I know one of the big issues that we've been dealing with is this whole distance issue. And so I'm very proud at the national level, but also our state chapter level. We've been since last summer at the data really was there and has continued to come in further to support 3 feet as really an actually very good distance to do for safety. So what you're actually,
so the slide here, I see you have really talks about exposure risk based on some studies with masking, very important with the masking and the distance. And it looks like when both folks are masked, again, at 6 foot, 3 foot, and even at 1 foot, the actual percentage of exposure risk remains extremely low, and that less than 0.5% that we've even been talking about transmission within our schools, if you're having fidelity to masking.
Yep. So this came out of the Mayo Clinic, and that I think really the takeaway from all of this, of all the prevention strategies, mask wearing, and you're hearing that from Dr. Fauci and at the national level, that is the single most important thing we can do, and is really the predominant thing that is reducing rate of infection spread that we're seeing. And so you can see, when we're talking about 3 and 6 feet, I think it's important for people to understand that the data that drove that dates back to the 1980s and is really driven not by people. It's actually, the studies are done not wearing masks. It's about droplet and aerolization, and it's not, and mask wearing in that data isn't part of that equation. And so when you throw the mask in, that really changes the equation of what we need to be talking about with physical distance. And I think that's kind of gotten lost. And in the beginning, we didn't have, we really were working in the dark. But now as we go and we understand more about the virus, we understand that it's really primarily aerolized and droplet spread. And mask wearing is really the thing that's doing by far the most.
So, Dr. Martin, it sounds like, as you said, masks are one of the keys of our school mitigation strategies. I wonder, as we continue to look at this data and have conversations in the medical community, the CDC's gone from 6 feet. Now it's gone to 3 feet. There's some, again, looking at some of this data from the Mayo Clinic that suggests even at 1 foot, which answers some of the questions about callers. Well, can you get every kid in at 3 feet? What would you do? Where do you think the medical community and the CDC will be going as they continue to look at the data in the months ahead?
The other big variable you have coming into this is going to be the COVID vaccine. And so I think it's very realistic that we're going to be able to go to lower distances. And I think, while we're not at that point yet, I think we're going to continue to be looking at that, and you'll continue to see this evolve. And I'm certainly hopeful as we, as the population gets more vaccinated and we hopefully reach that point of herd immunity, that we're going to see that improve.
Well, that's very positive news, and thank you so much for sharing that information. I want to ask you about some other larger issues that are out there right now in our community. What do you think some of these other larger issues are, but beyond the debate about 6 feet and 3 feet or how many feet, beyond mask wearing being so central, such a game changer for safety? What are some other issues that you think our community needs to know about from your vantage point as a doctor and pediatrician?
Sure. So I think one of the things is when we see, and you may have this data from schools as well, but when we look at places where there's breakdown and there is spread, it's really where where people start to go within those short distances. So sports, for example, is a great example, where people, we can do it safely, but where the breakdown happen is often when people stop following the rules. Very simple things where they're not wearing their masks, they're taking them off, they're sharing car rides, they're sharing a meal in close distance. Whether it's in school, and where we're seeing the most spreads often adult to adult between teachers, is in areas where they are actually eating together or sharing a common area.
So Dr. Martin, I, as part of being superintendent, have a teacher advisory council that I meet with monthly, and one of the teachers today asked, gosh, me and my colleague are vaccinated. Can't we just take our mask off and sit together in a classroom? and we told that teacher, Dr. Boyd was with me, we said, I know you want to do that, but you simply can't do that. We have to have a culture of mask wearing in our schools, not only for the safety of our adults and the safety of our kids, but to model what we expect of our children, what we expect of guests and parents and visitors as they come in, and especially if we're going, and we are, returning to 5-day instruction in the fall. Every child most likely will not be vaccinated, even though we still see promising news around vaccination rates. What is your perspective on that? Did we say the right thing to that teacher today?
I think that's the right thing. And I know it seems somewhat contradictory because the absolute rule, right, the CDC is giving guidance that if you're both vaccinated, you can go out to a restaurant and do there's some, which there's science too, but especially in the learning environment or group environment, I think you're going to start to see people break down when they see other people because they don't know who's vaccinated, who's not.
Correct.
And the kids don't understand that. We have to set the example. Same reason we're sitting with our masks. We're all vaccinated. It's really important, the optics that we're sending the message to folks, because we're only talking about, I think, 19% of the population, both in the state and nationwide, is vaccinated. And so a lot of people aren't, and they don't. And we have to set that example and tone.
We still have a lot of catching up to do with the COVID-19 vaccination. One thing that I've heard you talk about is we may have catch up to do with other vaccinations. Talk to me a little bit about that. How is that an issue? And what should our community know about that?
Yeah, so one of the many things that we saw with kids when the pandemic initially hit is, just like adults, people stopped coming into their doctor's offices and appointments. And so kids really got behind quite a bit on vaccines. In adolescents, we were seeing drops of 70 to 80% of vaccine rates. And in younger kids, 30 to 40%. We've had some recovery, which is great. I will tell you, pediatric offices are open, and we're using all the same rules and being very safe in seeing patients. But we're still finding probably 20, 30% rates down, depending on the age and the vaccine. And so that's going to be really important moving into the fall as we do get back to school, and why masks certainly do prevent a lot of these illnesses. Some are more infectious, and there are going to be times that
we really need to get parents then preparing now, this spring and summer, who have not brought their children back into schools, to get their children vaccinated with all the regular vaccinations that they need to have to return to school.
And you're going to want to plan ahead, because it's one of those things that if everyone waits to August, it becomes very difficult to deal with that load. And now's really the time to do that.
Great. Well, let's take some calls, Dr. Martin, if you're willing to do so. Glad to have you here. Caller, welcome to the Return to School Town Hall.
Hello, yes. Can you hear me?
Yes, good evening. Welcome.
Hi, good evening. I just was wondering, this year Fairfax County Public Schools has received a waiver for its educational requirement, and so we're not meeting the 180 days teaching requirement or the 990 teaching hours per school year. And I'm wondering what Fairfax County Public Schools is doing to address the learning loss associated with this past year for all students. I understand that there's a plan in place to help our most vulnerable students, which is great. However, I'm wondering what Fairfax County is planning to do to help address the learning loss associated with the entire student population. Other schools across the country have been open for in-person instruction 5 days a week and have been so since the beginning of the school year.
So thank you for that question. That's a great question. One of the things we have really been able to provide for many students a full year of the kind of instruction that they have needed to be successful. Many of our kids have done very well in virtual. Some of our kids have struggled. We've shared that and documented it. We are going to have summer programs 10 times the amount of a normal summer program opportunity. We'll have enrichment programs. We will have some catch-up programs that are really about unfinished learning for our kids, not learning loss. And many, many of our students will have the opportunity for enrichment programs, programs in the arts. So those are going to be available to all kids. And we encourage all families to really begin to look at all the summer opportunities that we're going to have for children. Many of our students, again, can benefit from programs like Bridge to Kindergarten, Bridge to First Grade. We're really excited, too, to be able to provide some credit recovery for kids that struggled. But kids that have been successful have covered the essential elements of the curriculum, and there will be enrichment activities this summer for them to look at. We really believe we have done a very careful but important balancing act of giving the essential curriculum that they needed and making sure that they're prepared to move on and be successful in the next year of learning here in Fairfax County Public Schools. So thank you for your call. Let's take another call. Caller, welcome to the Return to School Town Hall. Welcome.
Hi.
Hi.
My question is about ventilation. And I know we're hearing a lot of districts are spending a lot of time making sure that schools have proper ventilation or that outdoor areas are being used for lunch and other reasons.
Sure, thank you. Well, we've been spending a lot, we don't have Mr. Plantenberg with us this evening, who's our facilities expert. We've been spending a lot upgrading our ventilation systems, our filtration systems. I want you to know that air exchange in our current HVAC systems across the county is far above the federal standard. You're hearing about some school districts that are antiquated with old systems that are far out of reliable use. We have much more airflow exchange of outdoor air into our indoor air beyond what federal guidelines are. And we're also investing in the opportunity as we go to the fall. Back to one of the questions callers said, hey, how are you going to make it work even at 3 feet? To create outdoor classrooms, to have tents available outside for kids, to be able to have outdoor learning spaces that we already had, but also create tent spaces for additional outdoor activities. Dr. Martin, do you want to say anything else as well about any work from the medical field around ventilation that would be important for us to know that maybe we haven't shared as school officials?
No, I mean, it's been definitely an issue in other areas of the state. I don't think Fairfax, I mean, I think when we actually have someone on our task force kind of dedicated to this issue, which goes way above my knowledge base. But I will say Fairfax County has not been the area. There are some schools that are really going to struggle. But I have to say, like in other areas like buses and things, just a simple, opening of windows can be, if you can get airflow through, you do have to be careful how that's done. And doing, I think as we go into warm weather too, again, the biggest time is going to be when the masks come down, that you're going to worry about that. And so really being mindful of where you are for the lunchtime and those times when we're doing mask breaks becomes really critical.
So, Dr. Martin, thank you. Dr. Boyd, talk a little bit about lunch, because one of the things people are going, oh, why isn't it so easy to bring everybody back? Lunch is one of the challenges that schools are facing right now in Fairfax County and across school districts. What are we doing at lunch, and what are those guidelines? Can kids sit 3 feet from each other during lunch?
No. So, Dr. Brabrand, thank you for bringing that up. So while the CDC guidance has allowed us to reduce from 6 feet to 3 feet in classrooms when masks are in place, we know that while we're eating, we have to remove our masks. So anytime masks are not being used, we kick back to that 6 feet social distancing. So that does create a unique opportunity for our building leaders as they look to bring in more students in, because in the classrooms, you're planning between 3 feet to 3 feet between students. But as we go to the lunchroom, you now have to ensure that you have 6 feet between students. And so we have some schools that are doing some very creative things, such as creating outdoor spaces, outdoor lunchrooms. Folks have converted some of the hallways into lunch spaces and have created different plans for supervision there. So people are really trying to think outside of the box so that we can support additional students, 4 days of in-person instruction. But that's where some of those unique challenges and opportunities come into play. So it may just seem that it's easy to just double the kids that are in, but we still have to plan for those times where masks are not being used. And as Dr. Morton said, when we talk about mask breaks, for persons who may have mask exemptions, we still have to plan, if a person has a mask exemption, 6 feet from that person and others. So there are some different nuances that kind of interplay with the expansion of 3 feet that we still want to make sure that all our schools are adhering to keep students and staff safe.
Thanks, Dr. Boyd. Let's take another call. Caller, welcome to Return to School Town Hall.
Good evening, Dr. Brabrand. Thank you for taking my call. I have a 10th grader and an 8th grader, and my 10th grader came home irate. She had full PE yesterday, full PE in 75-degree weather at about 10 o'clock in the morning. She couldn't change out, so she had to go through the rest of her day fully dressed in the same clothing that she had to run stairs in the stadium in. So as we consider moving from 3 feet to 6 feet, how does that impact students who are expected to change out for PE? And as well as students who, like my 8th grader, cannot actually enjoy lunch because they are so restricted on how they can communicate during lunchtime. So I respect we're moving to 3 feet possibly, but how do you respond to lack of PE change-out options and the lunch restrictions?
Well, thank you very much, caller, for that question. You know, that's something I'm going to go back and share with our PE supervisor and our principals and see what additional flexibilities we can provide so that your daughter isn't in that position of feeling uncomfortable for the rest of the day. How can we do phys ed in a way that respects that issue? And so I appreciate you raising that issue, and I'm going to take it back to our PE county leadership and to our principals and work on that piece. As far as continuing to move from 6 feet to 3 feet for our students, we're going to continue to really work with our principals, work with the safety teams in giving feedback and making sure that we continue to do it safely. So thank you again for that call. Let's take another call. Caller, welcome to Return to School Town Hall.
Hello, Dr. Brabrand. My name is Owen Esbar. As a former student of FCPS back in 2019, and seeing, the current situation we're in now with this pandemic, I'd like to know, with the vaccine being pushed out, the Pfizer vaccine being deemed safe for kids 16 and older, is FCPS going to encourage students to get the vaccine, and will there be communication with parents? And, yeah.
No, that's great. Dr. Boyd knows, because this is something Dr. Boyd and I are actually talking about. And I just want to say up front, like everything else, people hear about it and they want it now. Why don't we have kids at 16 right now? Because there's still a lot of people in line ahead of those groups. We haven't even moved to the phase yet where our 16-year-olds and older are available. So Dr. Boyd, but talk about that we are working to plan and plant the seed now and build a foundation for expanded access for our kids to be able to have vaccination opportunities in the future.
Yes, so thank you, caller, for the question. We are working very closely with our local health department and also our Office of Communications And we're really going to be pushing out some messaging to families to make sure that they know when the window opens up mid-month for persons 16 and older to be able to access the vaccine, because we want them to be registered. We're working closely with the health department to explore any potential additional opportunities that we may be able to implement to support families. We know that our health department is still supporting the wide mass vaccine registration process and implementation process, but we're trying to partner to get as many students as possible who are eligible for the vaccine to get vaccinated. And the other piece to just highlight is that there may be some students that may be eligible now that are high risk that have access now. And so that's another key piece. I believe that, and I'll use the number, I think I'm recalling it correctly, but a couple of thousand students in Fairfax County that are high risk have been vaccinated. And again, we want to really work to be able to make sure all of our families are aware of the process and when their students are eligible. We know there's much information coming for folks, and we want to be a resource and support. And we will have webinars and supports in all languages to be able to support our families, to make sure that they have the information to ensure that their loved ones are vaccinated as soon as it becomes available, if that's their choice.
And you know, I've been talking with our county executive, Brian Hill. I know he's been in discussions with his board of supervisors and Chairman Jeff McKay. We continue to advocate to get as many doses of the vaccine here in the Northern Virginia area. We have the capacity to vaccinate tens of thousands of folks a week. We have huge demand for it, and we need and want more of those vaccine doses here. I believe, honestly, that this school system and this community can have one of the highest rates of vaccinations in the country, and quicker than almost anywhere else in the country if we simply had the doses. Our people are ready. Our students are ready. Our staff, based on our best data, over 90% responded to the opportunity to have vaccinations. I know a VCU poll came out a couple of months ago that said Virginians in Northern Virginia, 90% of them said they would take the vaccination. We simply have a supply issue here, and I know that our county leadership is working at the state level, at the federal level. We need more vaccination doses. So anyone who's close with the president of Pfizer and J&J, or the president of the United States, to work with the governor and Dr. Avula, our state health coordinator. Maybe Dr. Martin, you're the one to talk to.
I do want to plug in for pediatricians. So most your kids have pediatricians. We are being notified that we will be getting doses very soon. So there may be a lot of questions related to that. Talk to your pediatricians. They are going to be getting it. And so that's another access point for families to get as well. And I know you're going to have a lot of questions about the vaccines for kids, and we really do understand a lot about vaccines in general. We're sort of, that's our space. So that is a resource to all the families, and I would really advocate you reach out.
Great. Let's take another call. Caller, welcome to Return to School Town Hall.
Hello, can you hear me?
Yes, welcome, caller.
Hi, I had a question. I'm just curious, why is there no choice for virtual learning next school year? I mean, I have kids that are 12 and 7, and I mean, they're not going to be getting a vaccine. At least the 7-year-old's not going to be eligible for vaccine anytime soon. And I know it's been kind of said that, you know, a lot of kids are suffering from virtual learning, but I don't think that's necessarily across the board. I mean, my children are doing well. So I was just wondering why there's not that choice for those of us who are concerned about sending their kids back to school in an environment where the students themselves are not vaccinated.
No, caller, thank you for that question. I really appreciate it. And I have shared publicly that it's my intent to have virtual learning limited next year. And I want to share a little bit more why. I realize that many students have been able to be successful in a virtual environment. However, that is not the optimum environment for our students' academic, social, and emotional development. I do not think any school system in this country that wants to be a premier school system can continue to endure half virtual and half in person. We need to focus in Fairfax County Public Schools on our signature core competency of in-person instruction. The state has virtual options that are available. We need to spend our resources in bringing everybody home to Fairfax County Public Schools for in-person instruction. That's the family that we've had. That's the culture we've had for decades and generations. It's why people have come to Fairfax. And I do not believe creating what would be a third year of virtual learning for kids is in the best interest of our children or of this community or of Fairfax County Public Schools. Schools are essential and in-person learning is essential. And I think, Dr. Martin, actually your association, both locally and nationally, has really doubled down to say, yes, virtual could still be an option, but honestly, in-person is where we need to be for our children.
I mean, there's actually studies that predate all of this in terms of how kids learn, and there's so many other, like you're raising, there's so many other aspects of being in person that it creates that it's not the same. Kids don't get out of it, especially the younger the child's elementary kids are really learning social skills and developing relationships. And you just can't emulate that through a virtual environment. And so I know a lot of families have supplemented at home doing their own things, whether it's sports and things, but I would kind of argue one of the safest places if you're going to do that socialization, if you're supplementing it, is going to be in the school setting. I mean, that's what the data shows. So the kids that are, in many studies, we're seeing the kids that are at home virtual and doing these supplemental things, that's where they're getting COVID at higher rates than if they had gone to school.
Wow, now that's fascinating point.
That's really
Let me
important.
just hear that again, that in many cases, kids who've chosen to stay home and families that have had kids stay home virtually are seeing higher rates of virus transmission because of activities in the community or within the family than if they are in school.
Yeah, and that's even with some of the sports, I think you're seeing that. It's like one of the great things about school is structure. You guys are the best at creating structure, rules that everyone follows. And so I think that probably leads to why some of that is. And I don't think you can, and that's what the data is showing is that, the kids that are doing these supplemental things, like they're taking down the mask, that's a smaller group, they're in their pod. But that's where we're seeing a lot of spread. And I can say on the ground level, that's where I was seeing it as well.
Thank you, Dr. Martin. Let's take another call. Caller, welcome to Return to School Town Hall.
Hi, good evening. Thank
Good
you.
evening.
You mentioned earlier in reference to the enrichment classes that are being offered during school to help students during the summer. Are those courses going to be a fee course, or is it free courses, or is it multiple?
So some of the courses will have fees associated with them. I am also pleased to share that we will actually have some spaces reserved for students that are on free and reduced lunch, that we'll be able to have those tuition free. There'll be spots for kids who have economic challenges to be able to have those enrichment opportunities tuition free. And we'll be sharing more information about that very soon. So there will be opportunities for kids, enrichment activities, opportunities to finish unfinished learning, and we'll provide tuition in some cases, but we're also providing opportunities for tuition-free experiences for kids. And we'll have more information to follow on that very, very soon. Caller, welcome to Return to School Town Hall.
Hi, I was hoping if you could talk a little bit more about lunch. I have a middle school child, and they eat in the cafeteria. They're obviously 6 feet apart, all facing the same direction. But the capacity, even with that, in the cafeteria is over 100 people. And I just wondered if you could talk a little bit about concerns about that because, they're masks off for 30 minutes. So I understand that that would be the most risky time for them. So I just wondered, with bringing more kids back to school, what that is going to look like.
Thank you, caller. Dr. Boyd, and it's hard sometimes to even share with our community, that's why we do these town halls, how much discussion among our educators and our principals, how much has been around making sure we're keeping lunch as safe as possible. And can you talk just a little bit more about the commitments that people have made around making sure that happens? And really, us trying to do everything we can to follow the data so that we'll be able to identify if we are seeing trends in schools that bring us concern.
Absolutely. So hours upon hours and work groups and large work groups and small work groups have really been committed to trying to seek solutions around lunch, because we realize, and I know a previous caller shared, lunchtime is often that social, that mental break for kids. We like to eat and talk and socialize. And right now we just can't do those things because we don't have masks. We have to have the social distancing. We want kids to the greatest degree possible to be facing the same direction. And so it's really, really different. And so we're trying to think how we know kids need time to chew and digest their food properly. But when they're finished eating, even if the official lunch period isn't over, can you put your mask back on? Now I can engage socially with my peers the way, maybe not pre-pandemic, but at least in more of a way where we can have that social element infused into our lunch period. And so, again, our principals are really, really working with their school teams, thinking outside of the box, outside the building, in the building, in different places in the building, maximizing every possible structure of their element to create a sense that students would still be supported, because we know we have the health pieces, but we also know as parents and as educators that our students want to have a social element during that mealtime too. And so it'll look a little bit different, but keep working and partnering with us, because we're gonna make sure that we're able to support our students appropriately.
Thanks, Dr. Boyd. I want to go to a question on our email. If we can go back to the slide prior and put that up for viewers, not this slide, but one prior, please. It was around testing. We're talking about safety in the cafeteria. We're talking about safety in our schools with distancing. One other mitigation strategy that we are looking at, really being able to be buoyed by the opportunity of the administration and Congress passing the latest stimulus act, is providing funds for us to look at COVID testing. Can you tell us a sneak peek to the degree that we can? I know we're talking to the school board April 20th, but are we looking at piloting any kind of COVID testing that we do here in the spring that could actually help us in the fall really give another layer of safety about, yes, your kid's not vaccinated yet, or maybe it's not available for the little kid, but here's another layer. We're already less than 0.5%, and now we're going to have COVID testing. Talk a little bit about that, Dr. Boyd.
Yes, so we were informed of an opportunity to partner with VDH to engage in a pilot around diagnostic testing. So that's testing of symptomatic persons, where those persons would be able to be tested in school to really have that quick turnaround. So we have an existing partnership with the health department now for diagnostic testing if our families have access challenges or have delays in getting those results, whereby the health department utilizes their lab to do diagnostic testing. But this particular pilot would enable us to give that diagnostic testing right on site at school. And so we're
diagnostic testing on site at school for anyone with symptoms, staff or students.
Correct. And so that, again, and not only would be expedient, but also provide relief for some of the burdens that might be placed on families and taken off work to try and coordinate testing. And so we're really excited about that. The other pilot is a screening testing pilot where you're testing asymptomatic persons. And so again, that would be testing a subset of our students and our staff. And we're really excited about that because we can be proactive so that if persons are ill, they can, quarantine, isolate as they need to. And we can just really try and bolster that confidence of our families who may be maybe a little bit leery at this point. We understand that everybody's in a different position and that we can be proactive. And so
that's some of that pool testing that colleges did this year. Yes. We'll have the opportunity to look at doing that as well, along with that diagnostic testing for anyone with symptoms, yes. Quick in-school testing. We'll be finding out more information about that during our April 20th school board meeting?
Yes, we'll be giving some more information at our April 20th board meeting. We'll be submitting the information to VDH that we want to participate. We've already communicated our interest to our local health department. So we're excited about those possibilities.
What an additional great strategy. Anything you want to say about testing, Dr. Martin, from your viewpoint?
Our state's getting about $250 million, so we've got a lot of funds to work with to do this. So there are other pilots too in the state and figuring out. I think critical is one, if your child has symptoms, don't send them to school. Get them tested outside the school setting. We really don't want you sending your kids to school. Two, it's important. It's just one other layer of prevention, and so I think there's going to be some opportunities where we do see areas of potential outbreaks. Like right now, we're seeing a real increase in sports, and I think there's going to be some looking at even within our state and outside our state, looking at really doing surveillance testing in sports. And I think that's an area I would highly encourage you guys to look at if you haven't.
Yes, I just want to say to that, Dr. Martin, Dr. Boyd and I are already in discussions and working with Bill Curran and Mr. Greenfelder, all of our athletic folks, that testing, this pool testing, surveillance testing, would be a major component as we continue with athletics this coming year, so that we really can deal with the trend that we're seeing nationwide. While we've, again, had a pretty good track record, we have seen some outbreaks, and we really want to have every tool at our disposal to limit the amount of outbreaks for our kids, whether they're in the classroom or out on the playing field. Let's take one more call. Caller, welcome to Return to School Town Hall.
Hi, thank you for taking my call. I was wondering if Fairfax County had planned to give teachers and staff any additional prep days to prepare for this new change in policy and schedule. For example, I am a specialist teacher and my classroom is now going to be used for something else, and so I'm going to be teaching on a cart. And so will we be getting any additional unencumbered planning time so that way we can prepare ourselves and make these transitions?
Well, thank you for that feedback. That's certainly something we can look at and talk about. As a first-year teacher over 25 years ago, I started on a cart, and I know the challenges that it brings to prep for that. So that's something we can take a look at. We are going to continue, as we do the 4-day expansion, to continue to have the asynchronous Mondays that has the planning time for teachers. We knew that was a commitment we made at the beginning of the year, and that teachers so desperately needed that planning time. And needed it to do embracing the new technology, embracing concurrent learning. So we understand that, and I'll certainly take that feedback back to you all, to our folks, and get back to you. I want to thank all of you for tuning in this evening, and really appreciate, Dr. Martin, you coming out and bringing your perspective and your organization's perspective. Thank you for your leadership again in the community for almost 20 years. And Dr. Boyd, thank you again for all you're doing. I know you and many don't know, you're relatively new to the Fairfax family, not in the state of Virginia. You've been a longtime educator, but you're newer to Fairfax and came in the middle of this pandemic and have provided outstanding leadership for our students and families, and we're really grateful to you as well. And I just want to thank all of you for again tuning in to our Return to School Town Halls. We will continue to work to reach out and communicate with you and bring you the latest information around return to school. And we will see you again real soon with more information about return to school as we wrap up this year and prepare for an exciting summer and as near normal a fall as possible here in Fairfax County Public Schools. Thank you for tuning in, and have a great evening, everyone.